Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites umedicaldoubts.com and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary for the medical knowledge to general people and for reference to medicals. Today I am going to discuss about the indications of Caesarian section. Caesarian section is an operation for extracting the baby from uterus and abdomen by an incision in the abdominal wall and uterus. It should be a normal pregnancy without rupture or else of the uterus. Adequate parental care, improvement of operative technique, antibiotic and antiseptic drugs, improved anesthesia, the availability of blood for transfusion have made it possible to reduce the fetal and maternal mortality considerably. Indications for Caesarian operation: cephalopelvic disproportion and contracted pelvis. When the pelvis is so contracted that even after mutilation a child cannot be delivered per vaginum, it is said to be the absolute indication. When the condition is such, elective Caesarian section is the treatment of choice. In borderline pelvis and minor degree of disproportion, trial labor is the line of management. If trial labor fails, Caesarian necessary to deliver a live child. In spite of the safety rendered to Caesarian section under modern conditions, maternal mortality and morbidity will increase with the duration of labor, especially after rupture of the membranes. Hence, for obtaining the best results, careful selection of the cases must be made and undue prolongation of labor avoided. Caesarian section should not be the last resort of the obstetrician after other methods of delivery have been failed. Dystocia due to soft parts. Obstruction to labor is caused by ovarian or uterine tumors complicating pregnancy and may necessitate Caesarian section, as also partial atresia of the vagina, cervix and cicatrization in the lower genital tract. Inadequate uterine forces. Uterine inertia and incoordinate uterine action of all types fall into this category. When the uterine action becomes abnormal or fails, labor becomes prolonged and if permitted to continue indefinitely, the prognosis for the mother and the child gets worse. The risk to the fetus is apparent if labor is not completed within 24 to 48 hours after rupture of the membrane. Usually sedatives and in hypnotic inertia. Oxytocin drip are given a trial. When these fails and labor has lasted longer than 24 hours, there is a definite tendency to resort to Caesarian section. In fact, compared to previous years, there is a greater incidence of Caesarian section in this group. Antepartum hemorrhage. It is almost always a rule to do Caesarian section in all cases of type 3 and 4 placenta previa. In cases of type 1 and 2, it is preferred if the fetus is 38 weeks and over is alive and if bleeding is not controlled by artificial rupture of the membranes and oxytocin. The premature separation. In premature separation, Caesarian section is limited to some cases where, in spite of artificial rupture of membranes and oxytocin drift, labor has not established within 6 to 8 hours and the patient's condition is not improving. In spite of blood transfusion, Caesarian section should be considered. Pre-eclamptic toxemia. In fulminating pre-eclamptic toxemia, many resort to Caesarian section in the interest of the mother. In less severe cases in whom it is decided to terminate pregnancy and where vaginal examination reveals that response to induction will not be satisfactory, there has been an increasing tendency to prefer Caesarian section with marked improvement in fetal salvage rate. This increase in salvage has been rendered possible due to the very great improvement in the care of premature infants. Eclampsia. In properly selected cases, Caesarian section has the definite place in the management. In patients with closed uneffaced cervix, conservative management has failed to control the conversions within 8 to 10 hours of the start of treatment. Caesarian section would be indicated. Fetal distress and prolapse of the cord. There has been an increase in the incidence of Caesarian section for fetal distress. Whatever be the cause of distress, if conditions suitable for easy vaginal delivery are not present, when the distress is diagnosed, the tendency is now to resort to Caesarian section in the interest of the child. When the cord is prolapsed with an imperfectly dilated cervix and the fetus is in good condition, the best method of saving the fetus is Caesarian section. Malpresentations in association with contracted pelvis or other factors which by themselves may not be a primary indication for Caesarian section. Breech presentation in case of large baby is an indication. A persistent shoulder presentation in a primigravida at term is mostly dealt with Caesarian section. Persistent manto-posterior and deep transverse arrest may sometimes necessitate Caesarian section. Maternal disease. In diabetic mothers, Caesarian section is widely employed unless the obstetric history, the size of the baby and the state of the cervix make an easy vaginal delivery almost a certainty. It should be used in all cases in which the supervention of procremia takes immediate delivery highly desirable and the patient in whom the presence of a large baby is suspected. Heart diseases in pregnancy. In heart cases, every attempt is made to avoid Caesarian section in case of disproportion. It is wise to do a Caesarian section. Coarctation of aorta is considered by some as an indication for Caesarian section. Bad obstetric history and habitual intrauterine death of fetus. Patients who have history of repeated difficult deliveries and perinatal deaths of their babies in whom the fetal loss may have to be delivered by elective Caesarian section in subsequent pregnancy. As also patients who give a history of habitual intrauterine death about elderly primigravida. Pregnancy occurring for the first time after the age of 35 is by itself an indication for Caesarian section. There are many who resort to elective Caesarian section on this indication alone. In addition, fetal monstrosities like double monsters may require Caesarian section. A combination of minor adverse factors necessitates a Caesarian section in the interest of the child. For procedure of the Caesarian section is given in some other article. That's all about the indications of Caesarian section, and in the next video I will discuss about some other disease. Thank you.